Okay, this is Dr. Mcdougall on a gluten-free diet, and this is available in more detail from Dr. Mcdougall's website, drmcdougall.com, and the title of his essay on the subject is Gluten-Free Diets Are Harmful for the General Population Except for 1% of People. So gluten is only bad for those with celiac disease or those who have gluten sensitivity. Gluten-free foods are not good for people who are not sensitive to gluten or who have celiac disease. Gluten is a protein in some grains, and part of it is not digested. Some people react to the undigested component. Just a little interspersed information here on the side. Dr. William Bolshevitz, he's the guy who wrote the Fiber Fueled book. He's the guy who looks younger guy, maybe 45-ish. He's a gastroenterologist, pretty famous guy. He claims that people aren't really having problems with the gluten. It's the problem is with something inside these grains called fructans. Okay, so be that as it may, celiac disease is a pretty serious disease. Celiac disease is a hereditary autoimmune disease. Gluten eating causes the immune system to attack the gut lining, and that causes leaky gut. Then you can get additional problems from the leaky gut. You can get autoimmune disease. You overactivate the immune system. They have an increased risk of lymphoma. Injury to the gut wall can cause malabsorption associated with diarrhea, abdominal pain, flatulence, weakness, weight loss. The definitive diagnosis of celiac disease is made by biopsy of the bowel, through endoscopy. It'll show villous atrophy, meaning a loss of the detailed anatomy of the intestinal lining, which typically is very convoluted to be able to have more surface area for absorption of foodstuff. You can also check something called a positive blood test for endomysial tissue transglutaminase antibodies. The treatment is lifelong strict avoidance of glutens, no wheat, barley, or rye. There's another guy, he's a pediatric gastroenterologist out of Harvard. His name is Fasano. He's written a lot about celiac disease, so if you're interested in that, you could follow it up there. Things that celiac patients still can eat, according to Dr. Mcdougall. They can eat some of these other grains: amaranth, buckwheat, corn, millet, quinoa, rice, sorghum, fruits, beans, potatoes, sweet potatoes, all green, yellow, orange veggies. People who have gluten sensitivity, and I talked about that recently in my book review of Retaining the Mind by the Mayo Clinic allergist William Walsh, and that can be associated with intestinal symptoms, bloating, diarrhea, but also with, brain symptoms, headaches, with depression, with brain fog, with arthritis symptoms, joint pain, muscle cramps, numbness, skin rash. So that's something else to be aware of. Most people, though, don't have a problem with gluten. I've seen people who had gluten sensitivity and then they became vegetarians, almost vegetarians, and it went away. Some gluten sensitivity patients improve with a FODMAP diet, a fancy way of saying fermentable oligosaccharides, disaccharides, monosaccharides, polyols. And, you might want to check out Bolshevitz on this. He's kind of a guy who's into all the details on this. He's a gastroenterologist, so he deals with this all the time. So if anybody's got that, that's fine. So the bottom line, though, is you don't want to be on these gluten protocols unless you need to be. And I think some of these symptoms people are having are because they're messing around with the food. They're doing genetic modifications of it. They're spraying different things on it. And all those things, can take a food that previously was, the mainstay of a lot of areas. Many large populations fed primarily on wheat and barley. Okay, the Romans fed a lot on barley. And you can ruin the food and now make it a problem for people. So anyways, we'll leave it at that.